When you give an IA, you also have to do a long buccal if you're doing periodontal therapy, because the IA does not innervate the soft tissues of the molars. So to give the long buccal injection, you take the needle parallel to the occlusal plane, hold the tissues tight, head straight back from the occlusal plane, and you insert about 3 to 4 millimeters in. You aspirate and then deposit about 1/4 of the crapula.
We're going to do an infiltration on the 23-24 area. The nerves are the long terminal branches. The areas to anesthetize for the maxillary is the pulp, soft tissue, bone in the area of the injection. For the mandibular, it's only the soft tissue in the area of the tooth. For the needle gauge and length, we're going to use a 25 or 27 short needle. The patient position is going to be supine. The operator position is going to depend on the area. The landmarks for the maxillary and mandibular is the mucobuccal fold, parallel to the root, close to the bone and apex over the tooth. For the mandibular only, you're going to use the junction of the lingual attached gingiva and the floor of the mouth parallel to the tooth axis, near the target tooth and close to the bone. The syringe position and location of the area of the injection is parallel with the long axis of the tooth, at the height of the mucobuccal fold and over the target tooth. Like so. The bevel orientation is going to face towards the bone. There will be no pressure anesthesia. The depth of the needle insertion for the maxillary will be at the apex of the tooth. For the mandibular, until the bevel is covered, about 2 to 3 millimeters. There is no osseous contact. Aspiration potential is less than 1%.
Negative aspiration.
The amount of solution is less than 0.6 millimeters over about 20 seconds.
To be aiming between the 2 premolars. You can also look at your x-rays and see where the mental foramen is on your particular patient. Does it go a little closer to the first premolar? Is it a little closer to the second? And when you enter right in between those 2 premolars, I've got minimum, I'm going to go to maximum, and then I'm going to deposit about 1/4 to 1/2 of the cartridge. I like to tell my patients that they're going to feel like they have a grape in their chin, and I'm going to push on that and massage it into the foramen.
An MSA injection will numb the mesial buccal root of the first molar and the 2 premolars. To give this injection, insert at the height of the mucobuccal fold over the second premolar. If the frenum is in the way, you can choose either side to insert. Insert about 4 to 5 millimeters, aspirate, and deposit about 1/4 of the carpule to prepare for periodontal debridement procedures. So there's a lot of times when I'm scaling and the tissue between 8 and 9 on the lingual is not numb, and so I'll have to give a Nasopalatine, and this is what that looks like. You're just going to insert right near that incisive papilla, a few millimeters, aspirate, and then you'll deposit your carpule until it blanches. It's usually only a few drops needed. There are also times when I've given the patient an ASA in this area and a local infiltration in this area, and there's one spot that is still not numb. I'll actually insert it, just like I would my probe, into the base of the pocket, and insert into the junctional epithelium, and it'll look like this. And you just deposit until it's blanches white, which is only a few drops needed. Sometimes the 45 degree angle is hard to visualize, so one way I do this is by keeping my syringe in line with the nose and with the corner of their eyebrow, like that. So to give the actual PSA injection, usually I'll have my patient shift their jaw to the left. That way you'll be able to open that jaw up a little bit more and see a little bit better. And you'll be inserting at the height of the mucobuccal fold, distal, over that second molar. Now your minimum does not have to be at your exact angles. Your minimum can be at whatever angle you want it to be at to begin with. But as you insert and progress towards your 45 angle, that's when you start working on getting your angle correct. Now a lot of times people will have this index finger in the way, so as you go out, you want to move that finger forward. And now as you can see, I'm in line with the nose and that opposite eyebrow up here. Then you'll aspirate and you'll deposit about 1/2 of the carpule for your periodontal debridement procedures.